Hello and welcome. Today, we're diving into a real mystery, one that frustrates so many of us, especially as we hit that age 50 milestone and beyond. We're talking about that annoying, stubborn lump in the back of the throat that literally just refuses to go away. You know the exact feeling I'm talking about. It's persistent, it's super distracting, and it honestly leaves you searching for answers. But what if I told you that the common assumptions about this whole issue are completely wrong? Let's get into it. Seriously, have you ever felt like there's just always something stuck right there in your throat? It's incredibly frustrating, isn't it? You clear your throat again and again. You cough. You swallow repeatedly. Maybe you even wake up in the middle of the night feeling like this thick mucus is just sliding down the back of your throat. It completely wrecks your sleep, it interrupts your conversations, and it kind of just feels like an endless battle. Well, if you've been dealing with this frequent throat clearing and swallowing, I really want you to know you're definitely not alone here. And in this explainer, we're going to figure out exactly why this is happening. Okay, let's dive into this. Here's our roadmap for today. First, the persistent throat mystery. Then, the truth about mucus. Third, 5 hidden mucus triggers. Fourth, the throat clearing trap. Fifth, your daily action plan. And finally, when to seek medical help. All right, section 1, the persistent throat mystery. Time to put on our medical detective hats and start solving this case. So most people operate under a pretty common myth. They think that this constant mucus is just, the lingering result of a cold, some acting up allergies, or, and this is super common for older adults, they just write it off as a normal part of getting older. They assume it's just basic wear and tear. But actually, scratch that, the reality is entirely different. While age can play a really minor role, it's usually not the main reason at all. The truth is that persistent mucus isn't just some gross annoyance, it's a critical bodily clue. It's a symptom pointing directly to a hidden, entirely different internal trigger that your body is desperately trying to manage.
Moving to section 2, the truth about mucus. We really need to reframe this from a villain to a hero.
Mucus honestly gets a terrible reputation, right? But the truth is, your body absolutely needs it. In reality, it acts as a heroic bodily function. Think of it like a sticky shield. It traps dust and tiny particles before they can enter deeper into your body. It captures unwanted germs. It acts as a totally normal, highly effective protective barrier for your lungs. So having a healthy amount of mucus is perfectly normal and incredibly protective. The problem? Well, that only begins when your body goes into absolute overdrive, producing way too much of it, or when that mucus becomes thick, sticky, and practically impossible to clear. It's a good system that's just been pushed past its limits. Section 3, 5 hidden mucus triggers. We're officially on the hunt for the 5 main suspects causing this overproduction. First up is a quick one, postnasal drip. This is a silent drip from seasonal allergies or dry air, and it happens when extra mucus drains down your throat, even if you don't actually feel congested in your nose. Now, what's really interesting about this next one is how sneaky it is. Suspect number 2, silent reflux. Most of us think acid reflux always means a burning heartburn sensation. Not true. Silent reflux is when stomach acid travels upward and irritates the really delicate tissues of the throat, but without causing any burning sensation in your chest whatsoever. No warning signs. So what happens? Your body detects this irritating acid and immediately responds by producing a heavy barrier of mucus to protect your throat. Those late-night snacks, large dinners, or just lying down right after eating, they might be quietly causing acid to build this stubborn mucus barrier while you're fast asleep. Our third suspect is dehydration. Now, as we age, our natural sensation of thirst naturally becomes weaker. That means a lot of older adults simply don't drink enough water without even realizing it. And when you lack hydration, your mucus becomes incredibly thick and sticky. Instead of flowing normally, it stubbornly clings to your throat. Look at this quote right here. Think about trying to wash honey off a spoon with only a few drops of water. It's basically impossible, right? That is such a perfect visual for exactly what's happening inside your throat when mucus becomes concentrated. It literally just won't budge. Let's walk through our final 2 suspects and notice how these everyday triggers can really compound the issue. First, certain medications. Everyday prescriptions, things for blood pressure, or even common allergy pills, can cause profound dryness in the mouth and throat. When those tissues dry out, the mucus naturally feels way thicker and more irritating. Second, environmental factors. Right inside your own home. The air conditioning, your heating system, hidden mold, or even the strong cleaning products you use every day can continually irritate your airways over time. Your body notices this irritation and, yep, you guessed it, produces more mucus to defend itself. All right, section 4, the throat clearing trap. Get ready for the biggest plot twist of this whole explainer. So, that habit you probably think is helping you out, it's actually the main villain in this story. Let's walk through this vicious cycle step by step.
Step 1, you feel throat irritation. Step 2, you aggressively clear your throat. And, you get some temporary relief. It feels like you fixed it in the moment. But here is the trap. Step 3, that violent clearing action actually causes further throat irritation. Those delicate tissues are just getting battered, which leads directly to Step 4. Your body detects this brand new irritation and produces even more mucus to protect the throat, which of course sends you right back to Step 1. It's a completely natural reaction that traps you in an endless, frustrating loop of mucus production. Moving to Section 5, your daily action plan. Time for some relief. So, the crucial point here is, how do we break out of this cycle and take our power back? Let's lay out the escape plan. Here are 5 concrete daily adjustments you can start making right now. First, increase your daily water intake to thin out that honey on the spoon, unless, of course, your doctor has advised fluid restrictions. Second, cut out trigger foods. We're talking spicy meals, fatty foods, chocolate, caffeine, and especially those late-night snacks that trigger that silent reflux. Third, try sleeping with your head just slightly elevated to keep acid down. Fourth, keep your indoor air comfortably humid, especially in dry seasons, to soothe those airways. And fifth, the ultimate cycle breaker. Avoid excessive throat clearing. Period. Instead, take a gentle sip of water or just swallow. These simple steps put control right back in your hands. Section 6. When to seek medical help. We need to look out for some important red flags. While those daily actions are super powerful, we do need to transition to a more serious note for a second. There are specific red flags that absolutely require a professional's attention. If your symptoms are persistent, worsening, or if you experience any of the severe symptoms listed here, like difficulty swallowing, unexplained weight loss, coughing up blood, or significant lasting voice changes, you must seek a medical evaluation promptly. These are big red flags that deserve a doctor's immediate attention. And just as a quick reminder, this explainer is strictly for educational purposes and isn't a substitute for professional medical advice. Always, always consult your healthcare provider before making major changes. To wrap up our investigation today, remember that chronic throat mucus is rarely the actual problem itself. It's a clue. Whether it's silent reflux, a dusty room, sneaky dehydration, or a medication side effect, your body is actively communicating with you. It is literally trying to tell you that something in your environment or your routine is irritating it. If you listen carefully, decode those clues, and take action early with the steps we've just discussed, you can totally manage this small symptom before it grows into a much larger frustration. I want to leave you with a question to reflect on as you continue your own health journey. Have you been dealing with this stubborn mucus in your throat? What specific symptoms or clues have you noticed in your own body? And out of everything we talked about today, what do you think is going to help you the most? Take a moment to really think about what your body is trying to tell you today. Thank you so much for joining me to solve this mystery. Stay healthy, stay informed, and keep learning.